All right, today we're going to be doing the skill check off of IV therapy. I'm going to start with my 12 safety practices. First, you are going to verify the care or order for the patient. The next thing you're going to do is you're going to remember to do hand hygiene before and after any client care and when handling any supplies. Next, you're going to review any policies and procedures at the facility you're working. You're then going to gather and assemble appropriate supplies for the skill. After this, you will then review manufacturer recommendations regarding the use of their supplies. You're going to knock on the patient's door, enter and introduce yourself, identify the patient using 2 patient identifiers such as name and date of birth, note the overall condition of the patient. You're then going to explain the procedure to the patient and you're going to provide for privacy. After doing this, you're going to raise the bed to a level for good body mechanics. You're going to don any PPE that is indicated. Following the skill completion, you're going to lower the bed to low position. The next thing that you're going to do is you're going to place the side rails per the care plan, and you're going to place the call light within reach. You're going to remember to tell the charge nurse of anything abnormal that happened during the skill. 13th one is you're going to remember not to give any IV push medications without your instructor present. We also will be giving medication during this skill. So we will do our 6 rights right now. That's right patient, right drug, right dose, right route, right time, and right documentation. All right, we're gonna go ahead and jump into the skill. The first thing we're gonna do is the order states to start a peripheral IV saline lock. I'm gonna go ahead and wash my hands and don gloves. If I can get them to go on. Okay. I'm gonna go ahead and prime my extension set tubing. I have my saline flush. Take my little extension set out. This would be capped to keep it sterile. We'll uncap it. This is sterile, so we're going to go ahead and connect to the hub. We're going to flush it until we see our saline. There we go. And we will lock it without touching that tip. I'm going to go ahead and place this back in here. Keep everything good and sterile. Now that we've done that, we're going to pick the vein that we're going to use for the IV insertion. I have my patient here. This is Teddy. All right. First thing we're going to do, Teddy, I'm going to apply this tourniquet to your arm. It's going to be pretty tight, but I'm going to use it to make those veins a little bit larger, and I won't leave it on there longer than a minute. All right. Do this the best we can with the teddy bear. You would tie it very tight. It's kind of hard with the bear, but it's on there. Next thing you're going to do is palpate the arm and look around and find a good vein. We have found a good vein here in the forearm. So I'm going to go ahead and remove the tourniquet, loosen it up. And the next thing that we're going to do is prepare the site. I'm going to go ahead and we're going to clean the site with our cleaning prep here. Just in a circular motion, 15 to 30 seconds, working outwards. We would let that dry. Now that that's dry, we're going to reapply our tourniquet. Okay, with our tourniquet reapplied, we have our clean IV site and our vein here. The next thing that we're going to do is we will take our IV out. Come on, Teddy, sit up. Okay. This is our IV catheter. I'm gonna go ahead and remove the tip of this. Okay, it's in working condition. The next thing that I'm going to do is I'm going to hold taut below the vein we're using, and I'm gonna insert at about a 15-degree angle. Okay, I got flashback in my chamber, so I know we're in the vein. I'm gonna go ahead and advance the catheter. Safety device is engaged. We're gonna pop the tourniquet, remove it, get our extension set tubing here. We're going to connect it to the hub of this IV site. We're gonna pull back, see blood return, and I'm gonna flush to make sure that the IV is patent. And we're patent. All right, I'm gonna go ahead And I'm going to tape the site down with the tape I have prepared there. I'm going to remove my flesh. I have a Tegaderm over here. That we will place over the IV site. That way it's clear and we can still monitor what's going on with it. I don't know if I can get it to do what it needs to do. Okay. And what I'm going to do here is I'm just going to tape the IV up. That we have it up good in place. The next thing that we would do is we would apply a piece of tape. We would put our initials and the date and the time when the IV dressing was applied and when it was started. After the IV is started, you would want to document that we placed a 20 gauge IV, peripheral IV, in the right forearm. We would chart that it flushed well, it was patent, and that there was no signs of phlebitis or infiltration, and that the patient tolerated the procedure well. All right, and on to our next order. The physician has ordered us to push 2 milligrams of IV morphine, stat now. With IV morphine, you want to remember there is some assessment you need to do before you give the drug. You need to check their blood pressure, you need to check their heart rate and their respiratory rate, and rhythm and depth, all that good stuff, because it can cause a respiratory depression, decreased heart rate, and it can decrease your blood pressure. So once we've assessed that and everything looks good, we're going to go ahead and prepare our medication. Now, the 2 milligrams, we're going to say it's 2 milligrams and a milligram per milliliter. So we drew up our 2 milliliters, 2 milligram IV morphine, and diluted it in 5 cc's of normal saline. Now that we're diluted in 5 cc's of normal saline, we're prepared and it's properly diluted. You're going to remember that with IV morphine, you will push this drug over 4 to 5 minutes. For pushing the drug, so as though we don't keep going over the time, I'm going to clean the hub. I have my medication prepared. I've done my rites of medication administration. I've told the patient what I'm going to do. It's prepared correctly. We're going to go ahead and attach, if I can get it in there. It's not saline, or it's not locked now. Well, go ahead and attach. There we go. I have 2 syringes here. We're going to flush the IV and make sure that it's patent. And it's patent. Now that we have flushed it with saline, we would get a new alcohol pad and clean again. We're going to attach the morphine. The next thing we're going to do is we will flush, or not flush, but we will push the morphine over 4 to 5 minutes. All right, once we're done with that, we will get rid of that. Clean again, and we will flush 5 to 10 cc's of normal saline behind that, and we will push it 4 to 5 minutes, the same rate we were given the drug. So we have done that. We're going to go ahead and clean that site again. So the patient has now had their IV morphine. They tolerated it well. Their IV's patent. There was no phlebitis or infiltration noted and no pain at the IV site. We're going to come back in 15-30 minutes to reassess the patient to make sure that they're breathing and their blood pressure and all that stuff is going well and they're not crashing. Our final order is for us to initiate IV fluids. We're going to do 0.9% normal saline at 150 milliliters an hour times 8 hours. So what we're going to do for this is we have primed our line and hung our bag of fluids here. We're going to come in, tell the patient what we're doing. We're going to assess the IV site. It's a good idea. I'm trying to get this line over here so I can use it. It's a good idea, once you've assessed the IV site, to unlock, clean, flush, and make sure it's patent. Once you've identified that it's patent, you can unhook clean again. You would uncap this so that you know it's sterile. And you're gonna hook it into the patient's IV. There we go. The next thing that you're gonna do is you're gonna make sure that the roller clamp is up, it's unclamped. You're gonna put it in the IV pump and set it for 150 milliliters an hour. With this, you would make sure to periodically check in on your patient with your rounding, assess their IV site, make sure there's no infiltration, phlebitis, or pain at the IV site. Once the 8 hours is up, the IV pump should let you know that the bag is empty, and you should be checking it about every hour or so to make sure everything's going okay. So that is all for this IV checkoff skill. Thank you.